Hi everyone, my name is Ashwant. I'm a TA for your course Drug Delivery Principles and Engineering, and this is a weekly problem solving session. So today is week 10, where we'll be looking at previous year's week 10 questions as well as some of this year's week 8 assignment questions, I believe. Okay, so let's go ahead and get started. Let me share my screen. Can someone confirm if they're able to see my screen?
Yes, sir.
Okay, great. Okay, so let's go ahead and get started. The first question reads, which of the following approaches is not suitable to improve the biocompatibility of a polymeric implant? Uh, so coating with hydrophilic polymers, coating with hydrophobic polymers, peg coating, reduce surface toughness, or make the material more porous. Which of these techniques is not a suitable approach to sort of improve the biocompatibility? Any guesses?
B and B.
Sir,
Sir,
option
option
C and
C and
D.
D.
Sorry, option C
Option
and
C and
A.
A.
Okay. Okay, so let's go through them one by one then, I guess. So coating with hydrophilic polymers is actually helpful in increasing the biocompatibility of the polymer, and you'll get to realize why when we start to discuss about coating with hydrophobic polymers, right? So what happens when you coat your implant with a hydrophobic polymer? So what you're essentially doing is you're providing a surface for uh, protein unfolding to happen first of all. So all these proteins with their hydrophobic inner cores, they're going to come to your polymer, and they immediately will start to denature. Their structure will start to unravel, and their hydrophobic cores will get exposed, and like they want to maximize entropy, right? So minimize entropy, right? So they want to expose their hydrophobic cores to the hydrophobic coating of your polymer, and then stick to your polymer. So that's not something you want. And also, what you'll find is if you have a hydrophobic coating on your implant. Sorry, just give me 1 second. Just give me 1 second. I have to fix something. Okay, so for some reason my camera has gone off, so we'll just continue like this anyways. Yeah. So what happens when you have like what you will start to realize is if you have a hydrophobic coating, you'll start to realize that most of these bacteria, pathogenic bacteria, have a very layered cell wall, right? So this cell wall is basically hydrophobic in its nature. So it's made up of various lipids and acids, and it is hydrophobic in nature. So essentially what you're doing is providing a harbor for this bacteria to come and stick to your implant. So coating with hydrophobic polymers is not something that you would want. Okay, so which means to say, so if you want to minimize these interactions, if you want to minimize this protein denaturing, bacterial adhesion, and so on and so forth, you would ideally want to have a hydrophilic coating on your polymer, right? So that will sort of contract all the negatives with the hydrophobic coating that we've just discussed. Okay. So coming to peg coating, so peg coating often will help in increasing the biocompatibility of an implant. Simply for the fact that it will not allow immune cells to come and completely interact with your, like, you have the ability to not let immune cells to come and interact with the surface of your implant, right? So with the peg coating you can prevent cells from interacting with the surface of your coating, so surface of your implant. So in that way peg coating can also increase the biocompatibility of the implant. Okay. So this goes back to the argument where you would want to provide as little of a surface area as possible, so that you're not providing a niche for bacteria to sort of colonize, or even for a large amount of proteins to start absorbing to your implant. So ideally you would want to have less surface roughness, right? Because as the surface roughness increases, the total area that's available, or the total surface area that's available for contact with bacteria or proteins, is also increasing. So reducing surface roughness should also be improving the biocompatibility of a polymeric implant. And yeah, so other than that, make the material more porous. This is application specific. So what people have observed is, if you make the, like, so people generally make things porous for cells to be able to invade them, right? In that way it's much more biocompatible because it's facilitating these cells to enter and colonize.
Your voice is coming very low. Can you just speak a little bit louder, please?
Can you hear me better now? Hello?
Yes, yes. Yes.
Yeah. Yeah, so I was just saying, so if you want your cells to sort of colonize your implant, you would want the material to be porous. So as to sort of facilitate this process of cell migration that can happen. So yeah, basically the answer is coating with hydrophobic polymers is not going to improve the biocompatibility of a polymeric implant. Okay. So which two of the following statements about vaccines are false? A therapeutic vaccine is given before manifestation of the symptoms of the disease. A prophylactic vaccine generates a memory for the epitope of a pathogen in the immune system. The polio vaccine is a prophylactic vaccine. A prophylactic vaccine is given after the disease has occurred. The purpose of prophylactic vaccine is to strengthen the immune system to fight against the disease. So, which of the A and okay,
ANC.
and C. Okay. Okay. So everyone seems to agree with A. So a therapeutic vaccine is given before manifestation of the symptoms of the disease. So that's not true, right? So a therapeutic vaccine is
Sir,
given.
option A and B is the answer.
Right. So a therapeutic vaccine is always given after the manifestation of symptoms of a disease. And D. So a prophylactic vaccine is given after the disease has occurred. So which again is not true, right? So a prophylactic vaccine is given to sort of prevent the disease from occurring. So it's given before the disease has occurred. So in the same vein, polio vaccine, is it a prophylactic vaccine? Is it a therapeutic vaccine? So is it given before the disease or after the disease? So it's given to children, right? So it's given to newly born children much before they're exposed to the polio virus. So in that sense, it is a prophylactic vaccine, not a therapeutic vaccine. Is that clear?
A and B would be correct, sir.
Right. Yeah.
Your screen is gone.
Yeah. I just realized. Okay. Yeah. A and D. Okay. Consider that the following molecular species are contained in a dialysis bag with a 50 kilodalton cutoff.
Sir, excuse me, sir. Can
Yeah.
you go back to the previous one? I have one question.
Yeah.
Sir, my question is prophylactic means that we give to much before the disease, right?
Correct.
And therapeutic vaccine is after the manifestation. So these rabies vaccines that we give is like therapeutic, should be therapeutic.
Correct. Yeah. So there are different types of rabies vaccine. So there is a prophylactic rabies vaccine as well. But generally, what in clinics, what people give after the dog bite, you take these five shots. I don't quite remember, but there are some shots that you take after a dog bite, right? So that's a therapeutic vaccine. So okay. So let me correct myself here. So
Is there any vaccine available just if some got contacted tetanus,
okay.
particularly is Clostridium tetani and their antigen? So is there any vaccination like, is available after the tetanus has occurred, or we have to give this monoclonal antibody there?
Right, right. So let me correct myself. So both the rabies vaccine and the tetanus vaccine are prophylactic vaccines. They're not therapeutic vaccines. So even the rabies vaccine. So if you guys know how the rabies virus works, so it takes time for the virus to migrate to your brain stem, right? So once it migrates to your brain stem, only then it will start. Uh, Only then the disease will start manifesting. So the vaccine is given to prevent this migration from happening. And in a similar vein, the tetanus vaccine, so the vaccine is given so that the bacteria, whatever toxoid that they are producing, is neutralized. So both of these are prophylactic vaccines. Is that clear?
Yes. Then what should be a therapeutic vaccine?
Yeah. So therapeutic vaccine. So in some cancer cases, there are a few therapeutic vaccines that people give to sort of elicit and like train your immune system to go and attack the cancer and so on and so forth. So generally for bacterial infections and all, we do not give therapeutic vaccines. We give prophylactic vaccines.
Okay, so thank.
Yeah. Any other questions? Okay. Consider that the following molecular species are contained in a dialysis bag. Uh, the dialysis bag has a cutoff of 50 kilodaltons. Which of the following molecules will be retained inside the bag? Pick two choices. Dissolved oxygen, glucose, free radicals, nutrients, complement factors, immunoglobulin G or immunoglobulin M.
F and G.
F and G, immunoglobulin G and immunoglobulin M. Okay. Right. So usually antibodies are of a much higher molecular weight than dissolved oxygen or glucose or free radicals, right? So they will be retained in the bag, whereas there's this free diffusion of nutrients and dissolved oxygen that can still happen. Okay.
So complement factors are also too small. They will pass.
Yeah, they will pass.
Thank.
Yeah. Okay. So tetanus. So as we were discussing, tetanus vaccine is an example of
D,
a.
D, sir.
Sorry.
Sir, option D. Toxoid vaccine.
Right. Yeah, correct. So it's a toxoid vaccine against the toxin that the bacteria produces, right? So, yeah. Okay. Which of the following is characteristic features of immunoisolated therapy, cell therapy? The immunoisolated cells have a polymer encapsulation which allows nutrients and small molecules to reach cells, but not antibody molecules and T cells. Cells are genetically altered to produce and secrete high levels of toxins. It involves replacing a missing or defective gene, or it repairs a malfunctional or non-functional gene.
A and C.
Sir, option A.
A.
Sir, both means two options are there in this question.
Yeah, so this
They are
question,
asking.
yeah, it
Two options are correct or one option?
okay. So I think that there's a lot of yeah. Okay, great. So last year they were asked only one option.
Sir, then
A.
option A.
Yeah. Okay, yeah. So basically, immunoisolated cell therapy is where you have uh, cells that can do something that, but they are still susceptible to your immune system, right? So what you do is you encapsulate them in a polymer, so that there's not there is still a diffusion of nutrients in small molecules, but not your immune system itself, such as antibodies and T cells. Okay. Which of the following molecules will not be able to enter through a semi-permeable membrane of 50 kilodalton molecular weight cutoff?
E and F.
Okay, yeah.
Last two.
Yeah, basically a similar question to what we had. So T helper cells and B cells are of a much larger size, right? So they're of micron size. So they would have a very high molecular weight if you were to calculate. So they will not be able to uh, enter enter or exit. Okay. Which of the following statements about vaccines are false? Okay, so this is also similar to what we've had previously. So, therapeutic vaccine is given prior to a disease. Prophylactic vaccine creates memory for the immune system. Prophylactic vaccine is given after the disease has occurred. Polio is a prophylactic vaccine. Cancer vaccines can be therapeutic and prophylactic. Yeah, so therapeutic vaccine is once again given after the disease, whereas prophylactic vaccine is given before the disease has occurred. Okay. So, what is an adjuvant in context of immune
So
response?
option C.
Option C. Okay. So, adjuvant is a molecule against which response needs to be generated, is what you're saying. Okay. Let's go through the other options as well. So, is it a molecule that inhibits proliferation? Is it a molecule that stimulates an immune?
No.
Sorry.
So B is there that stimulates immune response to target antigen.
Okay. Yeah. Yeah. So, is it a molecule that induces mutations? No, right? Is it a molecule that impedes the launch of an immune response? No. If anything, it facilitates the launch of immune response. That's why you're adding it along with the vaccine. Is it a molecule that does not affect the immune response whatsoever? No, not really. Then why else would
So
you add it?
the option B is right one.
Correct. Yeah. So option B
See,
is
it target it allows of targeting of the antigen and itself not should be antigen.
correct. Correct. So it stimulates an immune response, not against itself, but against whatever the antigen that you're giving along with it. Okay. So, which of the following are undesirable properties of a polymer used for immunoisolated implants?
Last two toxic and biodegradable.
Okay, yeah, okay. So, which of the following is a potential disadvantage of using particle-based approaches while delivering vaccine to antigen-presenting cells? Pick two choices. Okay. So, co-delivery of adjuvants is possible.
Last two E and F.
Okay, so you're saying the formulation can be unstable and the antigen might lose integrity in the process of encapsulation. Okay. Let's briefly look at the other options as well. So co-delivery of adjuvants is still possible, right? Like even if it's particle based, like you can load the adjuvant into the particle or onto the particle. So that's not a problem. All kinds of antigens can be loaded. Yeah, should not be a problem because proteins, peptides, DNA, anything can be loaded into a particle based formulation, more or less. Uh, the formulation can increase the in vivo half life of the vaccine. It's true, right? So it's what we have been learning in the class for a long time that particle-based approaches can sort of increase the half-life of the drug. Okay, so it allows for local delivery of antigens is also more or less true, right? So you can target the particles site. You can do site-directed like homing sequences. You can attach to the particle so that it goes to specific areas. So that's also very possible. So the only things that are sort of potential disadvantages are then that the formulation can be unstable and the antigen might lose its integrity in the process of encapsulation itself. So if you remember the single emulsion method and the double emulsion method, so single emulsion method you're basically dissolving your antigen in an organic phase, right? So there the antigen might lose its integrity, and similarly, it might not retain its 100% integrity in a double emulsion method. So those two can be disadvantages. Okay. A patient is
Sir, I
given.
have one question. Can you please go back?
Yeah.
Sir, regarding this potential, this particle-based approaches, so only the emulsion-based technique is available to prepare this kind of things, or any other method is available?
No, there are several methods that are available. I don't know. Rashid might have discussed this in the class, but so there are printing methods that are available. There are lithography based methods that are available where you can sort of control the shape of even the shape of the particle that you're preparing, right? So there are multiple methods that are available, and also like uh, so it depends on particle to particle, right? So for a PLGA particle, generally what people do is single emulsion or double emulsion, right? But if you're having a liposomal delivery system, then it will have this freeze dry technique of encapsulation and preparation, and then you pass it through an extruder to limit the size and so on and so forth. There are multiple methods that are available.
Okay, sir. Thank you.
Yeah. Okay. A patient is given a tetanus vaccine. After bacterial exposure, the patient was found to be infected with tetanus spores, which eventually germinated
So option B.
into bacteria. Okay. So, however, the patient did not develop the lockjaw syndrome. So, uh, yeah. So basically, if if you look at tetanus, so the reason people develop this lockjaw syndrome is because their immune system reacts very violently with the toxin that the bacteria produces, right? So, uh, because the patient has not developed this lockjaw syndrome, it seems to suggest that the toxin has been neutralized. So then tetanus is a toxoid vaccine. Okay. Which of the following statements are not true? Live attenuated vaccines give a strong immune response. Toxoid vaccines generate immunity against the toxin. Polysaccharide and conjugate vaccines have strict age and gender restrictions. Inactivated viruses are developed from killed germs. Example, heat inactivation. Inactivated viruses need not be supplemented with booster doses. Strict storage conditions are required for live attenuated viruses. Recombinant vaccines don't require booster doses. Therapeutic vaccines are given to strengthen the immune system to fight against an active disease. So, which of the following statements are not true? Okay, so let's go at them one by one. So, live attenuated vaccines give a strong immune response. True or false?
True.
Okay, yeah. Toxoid vaccines generate immunity against the toxin.
Yes, true.
Right. Polysaccharide and conjugate vaccines have strict age and gender restrictions.
I'm not sure. False maybe.
Okay. Yeah, so basically polysaccharide vaccines and conjugate vaccines are considered relatively safe. So they do not have as stringent age restrictions as some other vaccines like mRNA vaccine. But gender restrictions, we generally do not impose gender restrictions based on the biochemical makeup of the vaccine, right? Like so, polysaccharide vaccine, how does it matter if it's a male or a female? Polysaccharide is polysaccharide; it's still present in your body. Yeah, so it does not make sense to have gender restrictions for polysaccharide vaccines. So that might be false. Okay. Inactivated viruses are developed from killed germs. Example, heat inactivation. Right.
Right.
Inactivated viruses need not be supplemented with booster doses.
This is false, sir. They require some booster dose, like COVID-19 in case.
Correct. Yeah. So like yeah, especially the I don't quite remember the vaccine's name now, but I took the other one.
Covaxin was some kind of inactivated vaccine, right?
Yeah. Covaxin.
Bye.
So Covaxin is an inactivated COVID virus, right? So you still required booster doses for that as well. So yeah, inactivated viruses do require booster doses to be supplemented. Okay. Strict storage conditions are required for live attenuated viruses.
Yes, sir.
Okay. Recombinant vaccines don't require booster doses.
Yes, the American Pfizer vaccine was recombinant vaccine, I think.
Correct.
That was only one shot.
Well, so the Pfizer vaccine also is it's now recommended to have multiple shots as well. So there are a lot of recombinant vaccines, right? So I'll give you an example. So the hepatitis B vaccine that you take, uh, that's a recombinant vaccine. So the usual dose is 1 month, 3 months, and 6 months. And if you are if you're a girl, like you would take this vaccine against ovarian cancer, right? So against the human papilloma virus. So that's again a recombinant vaccine. So uh, that's also 1, 3, and 6 months. So recombinant vaccines do require booster doses. So booster doses are generally given to really establish a memory in your body, right? So you want the memory to be long lasting. So that's why you keep giving these booster doses. It's not because the vaccine is a so recombinant vaccines still also get eliminated from your body after 1 month or whatever, right? So they still require booster doses. Okay. Therapeutic vaccines are given to strengthen the immune system to fight against an active disease. Sorry?
Yes, proceed.
Yeah. So yeah, like we have come up with those three are the incorrect statements. Okay. A vaccine is found to elicit a
Sorry, sir, to disturb you, but can you go back to the previous question? No, the previous one. Because I had missed because of some connection disturbance. So the answer was toxoid. Yes,
correct.
toxoid. I was right. Okay, thank you.
Yeah. Okay. A vaccine is found to elicit a weak immune response with a short duration. How can one aim to improve the functioning of the vaccine? Give repeated doses over a short period of time, add adjuvants, add antibodies, heat inactivate the microorganism, change the route of administration.
Give repeated dose or
So
add
option B, I
adjuvants.
guess.
Option
A and B might be correct. Two options.
D.
D. Okay. Okay.
So adjuvants.
Okay. So let's go
Give repeated.
one by one again. So giving repeated doses over a short period of time is a little tricky. So it's generally not allowed for vaccines to be given over a very short period of time. So like if it's eliciting a weak immune response, that would mean that you will have to give the vaccine shot once every 14 days, 7 days. So it's yeah, so it's not socio-economically feasible. It's also not recommended to uh, give a patient such repeated exposures. Okay, so adding adjuvants is something that you can do very easily to sort of enhance the immune response, right? So adding adjuvants might be a correct answer, and adding antibodies makes no sense. Heat inactivating the microorganism, it does not, like the question does not give any evidence as to why the microorganism is eliciting a weak immune response, right? So is it because the microorganism is still live attenuated, or like do you have to do something there? So the question does not give you that information. So heat inactivation, maybe the microorganism is already heat inactivated, who knows? So might not be the correct option. Again, changing the route of administration, there's no evidence in the question to sort of suggest that it's the
Actually,
route is.
if I'm giving IV, but there's no effect, then how can change of route administration have more better effect? So
Yeah, so
last one is not true.
correct. So if you're giving IV, then there might probably not be a better route of administration, but generally most of these vaccines are given intramuscularly or
Yes, I'm an intramuscular. Sorry, I am.
yeah. Yeah, so intramuscular, so you can still sort of think about changing the route of administration, but the question does not suggest that this weak immune response is because of route of administration. So the easiest thing one can do to sort of enhance or strengthen the immune response is just add adjuvants. Okay. Okay. So which of the following properties are desirable for polymeric components of an immune isolated implant? They must be erodible. They must be
B and
Option
C.
option non-erodible
okay.
and
So
E desirable. What
okay.
option A and B, sir?
A and B.
Sorry, not A. B. B is the non-erodible. It should be non-erodible
Right.
and should be mechanically stable.
Right. Yeah. So you're correct. So it should be non-erodible first of all, because you would not want your polymeric protection to erode away and then your immune cells will all of a sudden come in and start attacking, right? So you'd not want that. So it should be non-erodible. It should also be mechanically stable. So if there was some movement around the implant, you don't want your implant to sort of rupture all of a sudden, and then there's this adverse inflammatory reaction, and the patient might go into a septic shock or even die, right? So that's not something that you want. So yeah, those two are the correct options. Uh, let's move on. Which of the following statements is not true? Grafted cells must be at least 200 to 500 micrometers away from the host environment. Microencapsulation offers best surface to volume ratio. Macro encapsulation devices are harder to scale up. Degradation of DNA in plasma is a major barrier for gene therapy. Oral route offers the most effective delivery for gene therapy, excluding immunization. DNA conjugated with liposomes doesn't undergo endosomal escape.
E. E and
Okay,
one option should be E.
right. What about this option A?
This is too
So
far.
option A, correct, means 200 to 500 micrometers, but it should not be more than 500 micrometer. Actually, in video I saw that was like that.
Sorry?
Means 200 to 500 micrometers is the best for grafted cells. So I think it will be correct, but not more than 500.
Okay. Any other guesses? E and F. DNA conjugated with liposomes doesn't undergo endosomal escape. Okay. Okay. Yeah. So E and F are correct. A is also incorrect. So I'll tell you why. So grafted cells must be at least 200 to 500 micrometers away from host environment. Uh, wh- which need not necessarily be true, right? So like you in the previous case you were studying about immune isolated systems. So space is not the limiting factor. So the only limiting factor is uh, the ability of your body to detect that the grafting that the cell is grafted, right? So they need not be 200 to 500 micrometers away from the host environment. They can be touching the host environment, but there should always be this barrier that sort of separates out the ability for the antibodies or the immune cells to pass through and reach the grafted cells. Okay. Yeah. Okay. So with that, let's look briefly at the this year's week 8 assignment questions. Okay. So what is the ideal size range of nanoparticles such that it can traverse through the smallest capillaries inside the body and not get cleared by the renal system? Any guesses?
Sir, is this recording will be available, right?
Yeah, yeah.
Because I have my data pack is almost over, so I have to leave. So I will see, watch it later. Thank you.
Sure. Okay,
Sir,
so
option A.
yeah, so option A. So basically, they're asking how do you maximize the time that these nanoparticles spend inside your body, right? So if it's less than 10 nanometers, what happens is like they get washed out, filtered out through by the kidneys. If it's greater than 5 micrometers, what happens is they get phagocytosed by macrophages and so on and so forth. So the ideal range is 10 nanometer to 5 micrometer. Okay. Which of the following is an ion?
Excuse me, sir.
Yeah.
In the previous question, option D, why is not possible? Can you please explain?
Yeah,
Option D.
option D is also correct, but so it's a much narrower range, right? So so option D is definitely correct, but option A is more correct than option D, if that makes sense.
But 100 nanometer to 200 micrometer, it's also between that range.
Correct. It is within that range, but the range is much broader than what like 100 nanometer to 2 micrometer, right? So if option A were not to exist, then option D would have been the correct answer. But option A is a much more correct answer than what option D is, because let's say there's a 90 or 80 nanometer particle. So then if you're saying option D is the correct option, you're basically saying that this 80 nanometer particle will get filtered out by the kidneys, or it's not going to circulate for a very long time, which is not true, right? So the minimum cutoff for kidney filtration is 10 nanometer, and the minimum cutoff for phagocytosis is 5 micrometer. So it option A is more correct than option D is what I'm saying. Option D is also correct. In the absence of the option A, option D would have been correct, but since option A exists, it's a much broader range, so it's much more uh, correct in a sense.
Okay.
Yeah. Okay. Which of the following is an ionic liquid? Acetylcholine, choline, and granite.
Choline and granite.
Yeah. Okay. The density of two particles are in a ratio of 1 is to 16. What is the ratio of their
Option
aerodynamics?
C.
Right. Okay. Yeah. So yeah. What size range of particles are well suited for deep lung delivery? 3 millimeter,
It's
4
option
meter.
D.
Okay. Yeah. 1 to 5 micrometer, right? So the aerodynamic diameter is ideal for deep lung delivery. Okay. The mechanism of particle deposition into lungs for large airways, bronchioles, and alveoli are in order are impact.
Answer yes.
Okay, yeah, impaction, gravitational sedimentation, and then followed by Brownian diffusion. Okay, where will particles of size 10 micron mainly deposit after dry powder inhalation? Pick two. So I guess we've discussed this briefly last week as well. Nose, mouth and throat, large airways, alveoli, systemic circulation. Uh, any guesses?
Mouth and throat and large
Definitely.
airways.
Yeah.
C and D.
Uh, so they're saying particles of size 10 micron. Remember, it's not in the aerodynamic range for deep lung delivery. So the aerodynamic range for deep lung delivery is only 1 to 5 micron. But here they're using a particle size of 10 micron, which means they might not be able to reach the alveoli, because alveoli is at the sort of end stage of the lung progression, right? So it will branch, and eventually end up in alveoli. So it's in the deep lung. Okay. Uh, which of the following statements is false for rectal administration? It bypasses first pass metabolism, useful for children as it might be difficult to find blood vessels, widely recommended in followed method, drug degradation by bacterial flora, uncomfortable.
Widely recommended and followed.
Correct. Yeah. Okay. Which of these statements are not advantages of intravenous delivery? Pick two. Invasive, drug completely bioavailable, rapid response, bypass first pass metabolism, chance of irritation and infection.
Invasive and chance of irritation and infection.
Correct. Okay.
Excuse me, sir. I have another one question.
Yeah.
Question number six. Before this question.
This one? Yeah.
No, no, this one. Before this.
This one?
Yeah, in the question it was asked about 20 micron, not 10 micron.
Okay.
So how large air waves will be possible?
Okay. Let me go back and check the question. Oh, so it's mentioned as 20 micron, is it?
Yes.
Okay. So that's a typo from one of the TAs. So you can raise a request. Like you can raise it on the forum.
Okay.
Yeah. Yeah. So it should be 10 micron and then it gets deposited in large airways and mouth and throat.
Yes, if it is 20 micron, then large air waves is not possible, right?
Right, right. Let me double check that also. Yeah, so large airways, it's not possible for 20 micron. Hello?
Yes, sir.
Yeah, you can raise it on the forum.
Okay, okay. Thank you.
Yeah, okay. This is done. Yeah, so there was a numerical calculate the aerodynamic diameter of a polymeric spherical particle with a diameter 2 micron and density 4 gram per cubic centimeter and shape factor 1. Report the answer in micrometers. Yeah, so I guess someone was asking a couple of weeks ago the importance of shape factor. So a shape factor of 1 means it's perfectly spherical, right? So the particle is perfectly spherical. So which means to say that so you have this formula of the aerodynamic density is diameter times the density to the power of the shape factor density. Okay. The aerodynamic density of a particle is equal to the diameter of the particle times the density to the power of the shape factor divided by uh, I think something else. I don't quite remember, but so that's where the shape factor comes in, and you can assume that the particle to be perfectly spherical, and basically the density becomes the root of uh, the shape factor term becomes the root term, so to the power of half, so that means you have to take the root of the density, so 2 times 2 is equal to 4. Okay. What are the advantages of using inhalers for drug delivery? Bypass first pass metabolism, manufacturing costs cheaper than oral drugs, improved bioavailability as compared to intravenous route, good for delivery to lungs, not very convenient to use.
A and DC.
Okay. Yeah. Okay. Yeah. That's all I had. Do you guys have any other questions?
Yes, sir. Some doubts are there regarding week 9 assignment. Sir, in first question, it was being asked regarding that inflammation steps processes. So, sir, actually, I am having doubts regarding that. What is the clearance and healing? It was being given, na. So, what is the clearance process that didn't understood? So that's why.
Which one is this? Week 9?
Yes, sir. The week 9 assignment question 1.
Okay.
Deadline over, sir.
The following so which of the following options represent the correct chronology of events in inflammation? Right? That's the question that you were asking.
Yes, sir. What is the clearance process that I didn't understood?
Okay. Yeah. So I guess we discussed this briefly last week also, but you're asking what immune clearance is.
Yes, sir.
Okay. So basically, what happens is, so inflammation usually occurs because there is some disturbance to the local environment, right? So there might be some infection that might have happened, or some bacteria that might have been present, or some other thing. So there is a disturbance that happens, right? So there is a part, or there is even so even in case of, like, if you go and prick a rose thorn into your skin, that will also lead to inflammation. So these things. So what happens is, there is a particle that has entered your local microenvironment that should not be there. So to in order to sort of resolve that particle and sort of heal the local microenvironment, inflammation happens. So what happens is, vasodilation is wherein your blood vessels sort of dilate up, like they increase in size to allow more blood flow to the area of inflammation. And because of this more amount of blood flow, there is edema or swelling. So what happens is, this blood flow is increased, and then this blood starts leaking out of your blood vessels. Not blood per se, but fluids and immune cells. So because these are leaking out and getting concentrated in your site of inflammation, there is this swelling that happens. And as a result of which, so as a result of this blood flow increase, there is also this increase of leukocytes, right? So all these T cells, B cells, they also start coming there. And the ultimate goal is to heal the microenvironment there. And if there is a disturbance, so for example, you like your skin pierces a rose thorn, and part of it remains inside, a very small part of it like enters your body and remains there. So that will result in inflammation, right? So what happens after this influx of leukocytes and all these neutrophils and all these things happen is, like, they sort of try to digest the whatever the particle or bacteria or whatever it is. They sort of try to phagocytose the particle and then try to digest it. And if they're able to digest it, well and good. But in the process, there are these cells that are also going to die. So your immune cells, they will start dying. And this will result in this pus formation, right? So this pus formation sort of gets localized to the area of inflammation, or wherever the object has entered or pierced. And clearance is basically, all your the rest of your immune cells, they sort of increase their phagocytic capability. And even if it's a dead immune cell, they'll phagocytose and try to sort of uh, clear up the pus and the object that has entered, if it's still remaining, and so on and so forth. So that's the clearance that they're talking about. So just to sort of make space for this healing to happen. Is that clear?
Yes, sir. So another question, week 9 only, question 9, that answer we have means it was being discussed previously only. So one option it is being given correct, another option is being not being shown, but it was being given zero only. So means having doubt.
I didn't understand.
Yes, so week 9 question number 9.
Okay. Okay, which of the following is not a
Not
physiological
physiological event occurring during inflammation. That's one, sir.
Okay. Yeah, so
Sir, only one option being given correct here, that reduction in temperature side of inflammation. That migration of immune cells was not given correct. But I think it's only one option correct. In option it was even given two options correct. So that's why, sir.
I see. So you're saying only one option was marked as the correct. So
Yes, sir, and given and also given a zero also.
okay. Yeah, just raise it on the forum.
Where sir means where to give the issues.
So there is a so as you log into your NPTEL portal, there is a forum where you can ask questions.
Okay, sir.
Yeah, let me show that to you. Yeah, any other questions?
Sir, another
Yeah.
doubt regarding sir for NPTEL exam. So for suppose for the two more than two options correct or two options question, if one option is correct and by chance another option will be wrong, then sir it will be considered as zero or 0.5 will be given. That
I,
having doubt.
I didn't understand. Could you repeat?
For the two options correct in questions is there na, means in question it will mention the two options are correct. If suppose one option is marked as correct and another is marked as wrong, then it will be considered as zero marks or it will be given 0.5 also.
Yeah, so I guess someone was asking this last time as well. So I've asked them to raise this question on the forum as well. So I don't know if people have resolved. I'll check back and get. So okay. So
Okay sir, which reason forum sir, having
yeah.
doubts sir.
Yeah, I'll check and get back to you on that. So most likely, you will have to contact the NPTEL office because the TS are not in charge of assigning marks. So especially for this, right? So if two options are correct and if you have selected only one, like we are not allowed to give you marks. So the NPTEL course coordinator is the one who sets the rules for this. So you might have to contact him, but I'll check and get back to you.
Okay sir.
Yeah. Also, I guess there's a question on the chat forum. Uh, okay. Okay. Yeah. So in week 9 assignment, question 9 is marked wrong. Okay. Yes. Even I have to say. Okay. Migration of immune cells away from. Okay. Yeah. So Vaishnavi. So Satak, right? Who has just asked the question.
Yes sir.
Yeah, yeah. So he has just asked the question. So I suggest you guys raise a request on the forum. So tell them that the week 9 question has incorrect options. And okay, so let me just show quickly where you can ask the thing as well. So okay, so this is what you see when you log into NPTEL, right? Hello. Okay, yeah. So anyways, there is a section called Ask a Question. So you can just click on that and it will direct you to this groups page, so where you can ask this question. So just hit on new conversation and just ask your question, put a subject and ask the question, and someone will get back to you. Okay.
Okay sir.
Okay, great. Yeah, with that I don't have anything else, so I'll see you guys next week. Thank you for joining.
Thank you sir.
Have a great week.
Thank you.